A very warm welcome to you all to the final session of the second day of our conference on how can we dismantle health inequity together, National Voices Conference to realise the power of the voluntary sector. It's our pleasure to have you all with us today. I'm Rebecca Steinfeld, Head of Policy at National Voices, and I will be chairing this afternoon's discussion. Today we're talking about race and health. But before we get into the issues, I just want to make sure all of you are able to join our conversation in a way that works for you. So I'm just going to quickly talk you through the tech here. We've tried to make this conference as inclusive, accessible, and interactive as possible. We welcome you all to display your pronouns in your Zoom name, as I have done. We have a palantypist with us here today who's capturing speech and putting it into writing. If that would be useful to you, please click on the CC at the bottom right of your screen. For those of the BSL interpreter, we're pinning and spotlighting them for you. We've enabled the chat box. Click on the bottom of your screen so you can introduce yourselves there. Please tell us what brings you here today. And as you listen to the discussion, feel free to share your reflections there. We're also pasting a collaboration document there. And you can share your contact details if you would like, so that you can be contacted by other participants today and contact others to take the conversations forward and plan joint action. We also have a Q&A box also in the middle bottom of your screen. If you have a question you would like to put directly to a speaker, please put it there and we will try to make sure that it is answered. Finally, we're going to be using some snazzy software called Mentimeter to ask you all to respond to a couple of questions during this session, and we'll paste that into the chat. Just to say, do not feel you have to use any of this, because we know it can be quite overwhelming, but we just wanted to make sure that people could tune in as they wanted to. And also, just to say, I've been told by my colleagues that there is a problem at the moment with the closed captioning that is not currently working. So just to say, we're aware of that, and we're working on fixing it as soon as we possibly can. Now that the tech is covered, on to the substance. So we're continuing a conversation about race and health inequity today. Obviously, it's an enormous topic. This morning, we outlined some of the parameters, how the gaps in income, jobs, and housing, and so on, generate gaps in people's levels of health and well-being, how some people face additional barriers to access to healthcare, or are treated differently when they come for care, and how together these create racial health inequities. In the session just before this one, which I'm sure quite a lot of you attended, we heard some inspiring examples of people and organisations taking really practical, constructive action to change the status quo. And now in the second of our member-led sessions, we are joined by Birthrights and Youth Access, both of whom are combating racial inequalities in mental health and maternity, respectively. And we're looking forward to hearing what they are doing in this space to challenge the status quo too. So I just wanted to hand over to Cara Whalen-Larty, who's Policy and Campaigns Manager at Youth Access, who I believe is going to kick us off with a round of introductions before talking us through Youth Access's work on racial inequalities in young people's mental health.
Thanks, Rebecca. So I'm Cara, I'm Policy and Campaigns Manager at Youth Access. I think we have a slide to explain who we are. So we are the membership body representing about 160 local services around the country, which offer youth information, advice and counselling. So the idea is to support young people with a whole range of issues that they experience along the journey into adulthood. I'm here today with Melissa and Amy from Birthrights, if you want to introduce yourselves.
Thanks, Cara. Hi, everyone. I'm Amy. I'm the Chief Executive of Birthrights. If you could move to I think it might be the third slide, which says a bit more about Birthrights. Just very quickly, we are a small UK charity. We champion respectful care in pregnancy and childbirth by protecting human rights. And we do that in three main ways: through advice and resources for women and birthing people and their families, through training for healthcare professionals, and campaigning to influence change in the system. And I'll hand over to Melissa.
Oh, you're on mute.
Apologies. Hello everyone, I am Melissa and I am the fairly newly appointed Participations Officer at Birthrights, joined last month. My role is focused on developing relationships and creating opportunities for effective, meaningful engagement and participation work with women and birthing people with lived experience across the whole of Birthrights as an organisation, but currently I'm mainly working on inquiry into racial injustice.
Thank you all so much for those introductions. I believe, Cara, you, oh no, sorry, is it Melissa and Amy? You're going to do an introduction to the key themes now.
Sorry, yeah. Could we have the next slide, please? Thank you. So, Cara, Melissa and I have identified there are 4 common themes across our respective work in this space on racial injustice in health. And so we're going to cover these by talking about the examples of our work internally and externally. It starts with you as an individual and as an organisation, and that has to be crucially the first step. Second, be led by experts, particularly experts by experience, and you must think about paying for their expertise. Create safer spaces and also brave spaces, and Cara will talk about what that meant in their context particularly. And finally, commit to move and move, even if that's small steps. All the small steps make a huge difference. So I'm going to hand over to Cara to talk about youth access's work.
Thanks. Yeah, so with this idea of it starts with you as the first idea, I wanted us to sort of think about what that means to us and what that feels like. So can we go to the next slide, please? Can we have the next slide? Thank you. And I think we were going to use a Mentimeter, a word cloud Mentimeter function for this. So the question that I want everyone just to consider as we sort of move into this session is, how do you feel about your role in the dismantling of systemic racism? That's a really big task. So how does that make you feel when you contemplate your specific role within that? So just think, what emotions does that trigger? Is it fear, inspiration, fusion? And also, can you just, as you're thinking about that, can you just note any physical feelings that sort of come with that emotion? Like, where does that emotion play out in your body? Is it something happen in your chest? Does it give you a bit of butterflies? Like, what is it that happens in your body there? And I think there should be a link to the Mentimeter so that you can add any of the words that describe those emotions or those physical feelings that come up for you.
I'm just going to come in here briefly, just firstly to ask my colleague Laura Porra if she could please just put the Mentimeter link in the chat. Thank you so much. And also just to say that we have come up with a solution for the time being for the closed captioning, which I believe now has come on automatically for people. If you would like to turn it off, if you just click on it, click on CC live transcript in the bottom, and you can put hide subtitle. And just to say, we're aware that obviously the auto captioning is not as good as having a Palin typist. We're really apologetic that it hasn't worked out for this session, but we hope that the auto captions will help those who need to use them. Sorry to interrupt you, Cara, and please.
Sorry to interrupt. I am the captioner. Can you please turn off close the automatic caption so that I can connect? Thank you.
Okay, sorry. Thank you.
It's okay. I understand.
Colleagues will help. So, Cara, you just carry on.
Okay. So I've asked people to think about how that makes them feel and any physical sensations that come with that emotion, with this really big question of our role in systemic racism. So I don't know how to gauge whether people have submitted something, but if we can see the results of that. Okay. Okay, so we've got overwhelmed as the big one. People feel overwhelmed, excited, exhausted, nervous, tired. I made that one. Hopeful, daunted. Oh, it keeps moving. Uncertain. Okay, but the big one there is overwhelmed, excited, exhausted, and then hopeful is there. So I think that we can all probably relate to those feelings. And if we could just go to the next slide on the deck there. What I was trying to get to was that this work does elicit emotions, and that those emotions play out in our feelings and in our bodies. So this slide here is a quote from Resma Menakam, who is a trauma specialist. He's written a book called My Grandmother's Hands, which is all about the work that we need to do to heal from racism and what he calls white body supremacy. And he says, the closer you get to the sun, the more you start to sweat. So the closer you get to the answers, the more questions you get, the more uncomfortable it feels. Actually, it can get painful. But you can also get stronger if you sort of train yourself, and he calls it reps. You do reps, and you learn how to get closer, and you learn how to overcome some of that discomfort. And sometimes you might need to step back, it's too close, or tag team in, swap in. But eventually you learn how to get closer and get to more of the answers. But the point I'm trying to make is that trauma and like racism, the system that we're trying to dismantle here, it does play out in our bodies, whether we're people of colour or whether we're white people. That there is trauma that needs to be undone in our bodies. And he has this idea about what he calls white body supremacy, which is this idea that the comfort of white bodies, people in white bodies, has historically and is still really put before the comfort and even the dignity of Black and brown bodies. And even the discomfort actually of having conversations like this one and like the ones that we hope people are going to be having, the discomfort of those conversations is put before the fact that if we don't have those conversations, if we duck out, then Black and brown people will continue to suffer and continue to die. And that's a lot, but we have to accept that discomfort and realise that discomfort is less than the act of not doing it. And that is an act of dismantling white body supremacy and white bodies being put first. And if this is a voluntary process for you, if you're in a white body, then possibly this is a voluntary process. For people of colour, this isn't a voluntary process. Like, that discomfort is there 24/7. And sharing that burden of that discomfort is a really important step to dismantling some of these structures that uphold systemic racism. So with that in mind, breathing through our discomfort and acknowledging that is part of the process, it's going to have to happen in our bodies. I'm going to talk about like our process at Youth Access. So if I can move to yes, thank you. So starting with us at Youth Access, firstly, we've got this question: why do we need to develop more racially responsive services? We've used racially responsive to get away from a lot of this language, do we use BAME? Do we use BME? Actually, who's categorized where? Actually, it's about racial responsiveness. So basically, we've got a couple of things first, which give us a bit of hope. So Youth Access, our members, they're typically based in the community. They offer a whole range of services. And research that we've done shows that our members actually serve a higher proportion of young people of colour than are served by CAMS or by school-based counselling services. Our services are typically easier to access, they're rooted in the community, so they're often like less stigmatised, and they offer this sort of whole life approach. So you could walk in and get some sexual health advice or some housing advice, or you could get some counselling under the same roof. But then we come to the flip side of this. If our services are not there for young people of colour, like, we're not perfect. If our services are not there, what does that mean? So in the mental health system at large, we see 40% people of colour are 40% more likely to be turned away from early help when they reach out for mental health support. They're also less likely to get support through primary care, so through their GP or self-referral, and actually more likely than their white counterparts to have it forced upon them through things like community care orders through the criminal justice system. Young people of colour, particularly young Black children, are more likely to be excluded from school, and we know that emotional problems manifest in bad behaviour. They're more likely to face punitive measures for that. People of colour, Black men in particular, 4 to 6 times more likely to be sectioned under the Mental Health Act, and again more likely to be criminalised and incarcerated. There's also figures around self-harm. This is a big issue. This is a big problem. If the mental health system isn't shaping up to respond to the needs of racially minoritized communities, this is has massive implications. And I just put that note at the bottom there, like we're potentially a stop along the way of what we call like the school to prison pipeline that happens for a lot of Black young people. We're a stop, like the mental health system isn't separate from that. We're a stop along the way, and we can either be there and help young people, you know, work through their emotions and find help, or they can pass us right by if we're not accessible, if we're not offering good experiences and outcomes. So just to check back in on those feelings, that when I think about that and like our role in that, that makes me feel like a little bit sick in the pit of my stomach. Like, oh God, this is actually really serious. We've got a lot to do here. But also gives me real hope that, you know, we can work towards something better. So if I can go on to the next slide. How did we think that we could develop more racially responsive services? So over the past 2 years, we've had a project called Equal Access in mind, which was designed to improve our members' counselling services for young women. And one of the target groups within that was young women from racially minoritized communities. And coming to the end of that project, there was sort of a realisation really of just how much work had to be done to truly say that you've got a service that meets the needs of those young women. And one of the key areas for development was around access to and experience of services for young people of colour. As a sector, I think we're always fighting for the rights of young people as a distinct group from children or from older adults. But actually within that, there can be a tendency to sort of homogenise that experience of young people. So I've flagged that equates to this sort of institutional colour blindness, and actually being colourblind, whether as an individual or as an organisation, doesn't help to improve access or experience or outcomes. If you're open to everybody, that can sort of end up being a bit of a passive state rather than actually an active thing that you're making sure that you are doing. But at the same time, we saw some really great practice that we wanted to highlight and make sure our other members were benefiting from that. So in terms of how we structured things, if I can move to the next slide, we'd had some conversations with members about like how can we create a space that supports this learning, and based on those conversations about the areas that they were maybe a bit unsure about, we sort of distilled these 4 key areas, and what we decided to do was actually do kind of an intensive course or programme over the month of February. So every week in February on a Thursday morning we had a 2-hour session for a closed group of our members. So there was about 6 organisations but about 12 participants, so there was like maybe a manager and a practitioner from each service. So there was the power to change things, as well as different experience in the group. In addition, we also set like pre-reading or like listening to a podcast before you came, and then we had homework and takeaway activities as well, so that every session people came with like the most like ready to learn and with a bit of background there. So the 4 sort of key areas that we dug into, the first one was about sort of an introduction to the issues, so how racism plays out in mental health and also those surrounding areas that I mentioned, so like education, criminal justice, inequalities in services and access, outcomes and experience, and also specific issues like racial trauma as a sort of area that's quite under research but might be showing up for young people of colour. The second session was about outreach and like meaningful inclusion, so tackling this idea of colourblind, our doors are open to everybody, and really thinking about what's needed to actually make sure those communities feel welcome in your service. The third session was about developing a racially responsive workforce. So we did look a little bit at sort of equality, diversity, inclusion strategies or policies, and recruitment, but actually we really discussed like the limitations of that and what it means to have a workforce actually who are trained, supervised, and actually have a culture whereby they can bring their lived experience and the lived experience of those young people and the politics that surrounds all of that into the therapeutic environment or into the youth workspace. And finally, we looked at applying it to our services, so the role of community-based youth services and what leaves us well positioned and what still needs work. And I really have to give credit to the members and other organisations that were involved. So I've flagged a few of our members. So 42nd Street produced that perceptions report. If you want to Google that at any point, like, it's a really great report looking at the experiences and perceptions of young Black men in how they see mental health and how they perceive services. Off the Record in Bristol has a brilliant project called Project Zazie for young people of colour. The Centre for Mental Health helped us. The Delicate Mind is a project for look at the intersection of faith, masculinity, identity and mental health. And Body and Soul are doing great work as well. Really importantly, we shaped these initial sessions with our members, but then we sort of handed it over to an expert facilitator. So we paid for an expert facilitator, and then we brought in this help from those other organisations as well. And I think that was really important, having a Black woman facilitator with a wealth of expertise in anti-racism work, collective care, so we could look after ourselves in that space, and creating a bit of distance really between youth access and our members and any power dynamic that could have played out there. I think all of that sort of helped create a safer environment. And it was really emotional. The whole process was really emotional, but it was clear really from the start, we had to be clear from the start. Our facilitator was really clear that we can't guarantee safe spaces. Like, this is, you know, this is a sort of risky environment. People might get it wrong, people might be triggered, you might be challenged, but we just need to be open to listening and challenging ourselves and working through that discomfort. And sort of by the end of the 4 sessions, we decided that actually what we created was a brave space rather than a safe space, that we had to come into that ready to learn and be brave. So the final point on the last slide, coming back to our 4 key themes, was about movements, moving, and us having to commit to move as part of that. So I guess what I sort of worry about in our field, like just the charity sector in general, like, we're all really good people and we don't want that to be challenged. We're all good people, really busy doing really good things, and sort of tutting at people, the bad racists over there doing bad racist things. And actually that can sometimes lead like a bit of a slippage into a role of maybe like a very disapproving but ultimately passive bystander. And I'm not saying like I'm innocent of that, like I've been guilty of that, because this work is really tiring and it's easier to just disapprove and look over there and wait for somebody else to do it. And that's especially easy if you don't feel that sense of care for one another to hold each other through that space. But movements need people to move, and that's not always at the front flying the flag, like, you know, busting down the doors. Sometimes that's just at the back, like picking up the stragglers, or just like at the gates trying to resist any further pushback. But the point is that we all in this whole hive of activity, like, we've all got a job, and none of us can sort of sit back and just disapprove. But yeah, that takes care. But I think the idea I'm really trying to get across is that we're all really important stakeholders in this, and we're all powerful. We all have a job, and sometimes it's quiet, it's slow, it's tough, it's in the background. It's not all, you know, Black Lives Matter on the streets of our big cities. For that to happen, it took years of work, years of slow, hard toil to get to those moments and make them worthwhile. So that's my plea to everybody today.
Thank you, Cara. So I'm going to talk a bit about the context for this work for Birthrights and why racial injustice is a human rights issue, or many human rights issues in maternity care, and just a bit of a trigger warning, because some of the themes that we will touch on are really horrifying, frankly, and you might have seen some of this in the news, but there's a whole range and many layers of racial injustice that are happening to Black, brown and mixed ethnicity people in maternity care at the moment, and I'm just going to touch on those to give some context for our work. So next slide, please. So I think what's really the main thing I want to emphasize here is that the statistics that many of you may have seen about the higher risk that Black and Asian women and mixed ethnicity women face of dying in or after pregnancy, these statistics aren't new. This has been known for decades, that there are higher death rates for Black and brown women in childbirth and birthing people, that Black, brown and mixed ethnicity people are more at risk of experiencing baby loss, both stillbirth and neonatal death, so death in the sort of few days after birth, and that there are higher rates of maternal illness as well. And, you know, preeclampsia, for example, which is can be a very serious and dangerous condition in pregnancy and childbirth. There's lots of evidence in the UK and in the US of higher rates of preeclampsia, far higher for Black women compared to white women. And with COVID-19, as in general, we've seen racial inequalities in how COVID is impacting on people. NHS England put out statistics quite early on in the pandemic showing that Black women were 8 times more likely to be hospitalised with serious COVID-19 during pregnancy compared to white women, and Asian women were 4 times as likely to go into hospital with COVID-19 during pregnancy. So there are a whole range of outcomes there, ranging from death through to serious illness, which are disproportionately affecting Black and brown people in childbirth. And it's not only outcomes. Some people have described these as the tip of the iceberg, and actually underneath that, there's a whole range of experiences that Black and brown and mixed ethnicity women and birthing people are experiencing more often, or worse experiences compared to white people. So a survey, just briefly, back in 2010, which was over 20,000 people in the UK, found that Black and brown, or Black and Asian women, was how they described it in the survey, were less likely to be offered or given a choice of where they gave birth, less likely to receive pain relief when they requested it during labour, and were more likely to experience an emergency cesarean than white women, more likely to have poorer communication with their caregivers. And all of these issues are really fundamental human rights issues. Birthrights, as I said at the beginning, campaigns for everyone to have equal access to safe and respectful maternity care. And you can see just from the kind of range of statistics, which, as Cara said, make me also feel really sick in the pit of my stomach and really angry and determined to play, you know, the small part that I can in trying to change things. There are multiple human rights issues going on. The right to life is the most obvious that's potentially at risk here, but also the right to be protected from avoidable suffering, the right to private and family life, to have a choice of where you give birth, to make autonomous decisions about what happens to you during childbirth, and crucially, to be protected from discrimination, which is a core part of our human rights law and our equalities law in the UK. And so for Birthrights, as a human rights and a legal charity, this felt like an issue that we really needed to be looking at as a strategic priority as a charity. Can we move to the next slide, please? So as a charity, we've always described ourselves as being there for all women. We used to talk primarily about women, and we are in our kind of inclusion journey, which I'll talk more about. We are very explicit that we're there for women and birthing people, anyone who is pregnant or giving birth in the UK. And we've always described our mission as being for everyone, but particularly wanting to focus on the human rights breaches that are particularly experienced by those who are discriminated against in the UK and therefore in maternity care as well. And so the racial injustice that I've described, which has been around for many, many years, forever, I imagine, felt like an obvious area of focus for us as we moved into the last couple of years. But just to bring it back to our themes, as we've said, this work always has to start with you. And, you know, as a white leader in the charity sector, it had to start with me thinking hard about my own role, where I've not tackled issues around this, either within charities I've worked in or been blind to it. You know, we talk about colour blindness. I thought that was a really, really astute point from Cara about how it's not good enough to just say we're open to everyone. You have to do harder work than that. So it started with us, and we looked quite hard at our organisation before starting to work on this as an external campaigning issue. We were an all-white team and an all-white board of trustees, like many charities. And you know, Charity So White is doing an absolutely outstanding job, and they're all volunteer campaigners to hold our sector to account, quite rightly. And we took a long, hard look at ourselves first, and we were really conscious and did a lot of internal thinking and consulting with Black and brown birth activists in this space as well about what Birthrights' role should be in this agenda. We didn't want to be white saviours. We didn't want to wade in where we weren't welcome. We didn't want to speak for people. But we could see such acute human rights issues going on, which felt so core to our mission as a charity. So we were quite thoughtful internally about how to take this forward. And that's why participation and partnership have been so core to our approach. And I'll hand over to Melissa in a second to talk about what that means in terms of the inquiry that we're running. But just a little bit on what we've done internally, and I'm conscious of time, so I'll just give a bit of a flavour. Leadership and governance is obviously vital. And sorry, I'm still on the previous slide. Leadership and governance is really vital. We did an audit of the board for skills as well as for demographics, and we did a big recruitment round. The only thing I really wanted to say here is that we were very explicit in foregrounding both the skills that we needed and the inclusion goals that we had, and the lived experience of pregnancy and childbirth, particularly of the groups that are most at risk, in this case, Black and brown women, had to be core, and that was really explicit in our recruitment. And the only reflection I'd give is that I've heard many charity leaders and trustees in the past say, oh, it's just really hard to find people to sit on boards. Nobody wants to do it. You know, Black and brown people just don't apply for these jobs or these trusteeships. And we had 70 applications for our trustee roles, the majority of which were people of colour, absolutely outstanding CVs and experience for a voluntary role. So I just don't think it's good enough for us in the sector to say that people are hard to reach or that they aren't there and they aren't willing to step forward. I think you have to be clear that you're a safe and a welcoming organisation. And I should have said at the start of this, I'm absolutely not saying that we're anywhere, that we're very far through our journey on inclusion. We've made some steps in the right direction, but it's a continuous journey and we're still partway through that. And there's, you know, ongoing learning and hard work for me and the team and the board to be doing. But our trustee recruitment was really positive. And just to go back to the emotions that Cara was talking about, it gave me real hope actually about moving forward as a more inclusive organisation and to tackle some of these human rights issues externally. Similarly, we've looked at our staff recruitment, been very explicit about inclusion as a goal, but also about using positive action where appropriate and where we want to address inclusion within the team. And we've made really small practical tweaks to our approach as well, which I can talk more about if we have time in the Q&A, but little things like sharing questions with candidates in advance and topics so that they can prepare for interviews. And the interview isn't about kind of who can play the game best and who can think on their feet better, but about who's actually got the skills and aptitude to be part of the team and take on a role. We've also committed to not having all white recruitment panels, which again seems maybe like an obvious and small step to take, but I know that it's still, from what candidates have fed back to us, it's still quite unusual. And other sort of tweaks to shortlisting approaches, for example, to look more at skills and tasks rather than at experience and CV. And then the last thing I just wanted to say before I hand over to Melissa in the team is we've been really explicit about our communications approach, whether that's being inclusive about gender and talking about women and birthing people, being really explicit that, you know, pregnant, trans and non-binary people, them having rights in pregnancy and childbirth doesn't diminish women's rights. Human rights are for everyone, and we as an organisation are for everyone, and we will be clear about that and take that on our social media pages when people are transphobic or racist, as we've experienced more recently, as we've been more explicit about our inclusion journey and our sort of commitments. Similarly on race, we've listened to what people have told us in the space about the use of BAME as terms by the NHS and sort of by health in general, and people have been very clear that they want us to talk more about not just sort of use language like black and brown, and that is also limited, as people have been saying in the chat, but actually to be really specific. And if you're talking about the experience of Nigerian people or Pakistani people in pregnancy and childbirth, then to be clear about that and specific about that, because monoliths and groups actually mask what's going on and might mean you kind of recommend the wrong solutions to change. We've also put money and investment into translating more recently and co-producing our fact sheets so they're genuinely inclusive and accessible for people from a whole range of backgrounds, not just with different language needs. And we've been very explicit about inclusion being one of our core goals, with the new organisational values and a public statement about this. But as I've said, I'm not complacent at all. We've got a lot more work to do internally as Birthrights, and it does start with you, and you have to start doing that work internally before you can start campaigning externally and continue to do that, and the two in parallel. So I'll hand over to Melissa, who will talk about our inquiry on racial injustice.
Thanks, Amy. Why did we design the inquiry in the way that we have? So the inquiry model was purposefully constructed in a way that seeks to look behind the data and to delve deeper into the who, the what, and the why of the statistics, really. There is, as Amy's touched on, already lots of evidence out there from the last 20 years and beyond, which tells us the same thing about Black, brown and mixed ethnicity women's and birthing people's experiences and their outcomes. We know that the problems are intersectional for these women and birthing people, often marginalised or disadvantaged in other ways. However, outcomes are still worse for Black, brown and mixed women, even when they're from a higher social class. So we based the inquiry on the hypothesis that systemic racism is impacting on Black, brown and mixed ethnicities people's basic rights to safe, respectful maternity care. We wanted to start with the notion, basically, that if systemic racism exists within our society, then it exists within our maternity services. I think that was quite radical for some people, but not for us. So we wanted the inquiry to be centred around people with lived experience, for them to be at the start and the heart of the inquiry and to be part of and working in collaboration with the expert panel. So the panel is made up of Black and brown people with lived experience, the experts by experience, as well as lawyers and other maternity professionals. Perhaps we can just skip forward to the next slide and we can have a look at them. So there's the first three pictures. As the first one is our chair, and that's Shaheen Rahman QC. And then we have our co-chairs. We've got next to Shaheen, we've got Banish Nazmeen, who's a midwife and the founder of South Asian Midwives Association, the founder of the Motherhood Group, which is an online community for Black mothers. Previous slide, thanks. Were we able to go back to the next slide, to the previous slide? Thank you. So that's our panel, and the co-leadership model means that we are led by them. So they met for the first meeting in February. There was a healthy debate in which the panel determined the scope of the inquiry, set out our terms of references, and we came away, we formulated some key questions for our participants. Those questions were then fed back to the panel, and they helped in the development of those questions for the call for evidence. And those questions were put to the panel, feedback was given by the panel, and the questions were adapted with their recommendations taken on board. So it's very much, as I said, a sort of co-leadership model. So the inquiry seeks to work in partnerships with communities, community leaders and groups and charities as well. So it's partly my job to tap in with those, link in with those organisations. The inquiry is UK-wide in its reach, so those organisations up and down the country, we're working with various organisations. So to name a few, we're working with an organisation called East in Wales, NCT, which has various locations throughout England and up and down the country, as well as various others. So the main part of the inquiry is the call to evidence, which is essentially gathering the stories behind the statistics. So what are Black and brown and mixed ethnicity women's experiences when they attend their maternity care? What does racism look like in this context? It's not just the overt acts of discrimination, like being told you don't need pain relief because you're a strong woman, that's the strong Black woman stereotype, but also the microaggressions, wording of questions on things like FGM, on consanguinity, for example, which are often directed at specific women from specific ethnic groups, and a lot of women find extremely offensive. So it's things like lack of resources in different languages and barriers such as being told you have to pay for your care if you've travelled from overseas. So we're taking all those stories and experiences, and as Amy touched on as well, we are looking at these experiences through the lens of the human rights lens. The statistics show already there's a possible threat to the right to life. And human rights law demands that all women and birthing people receive safe and respectful maternity care that meets their individual needs, that they have access to adequate pain relief, choice of how and where they give birth, and are able to decline unwanted interventions. The data's, and certainly anecdotally, it would suggest that this isn't happening for a lot of women. We want to work together within this inquiry to find out why and co-create meaningful solutions at an individual and system level.
Melissa, I'm just going to ask you if you could draw this to a close, just because we're slightly overrunning, and I'd love to be able to put some questions to you that have come up.
Sure. I'll briefly skip through the next slide if you get that up. Okay, so it's just to briefly go over our participation and partnership strategy. So as I said, the expert panel are leading this inquiry, and they've defined the scope and questions for the call to evidence, and dependent on the findings from the call to evidence, that will determine our actions, basically. So the call for evidence is undertaken in 2 ways. So we've got a broader reach online approach, where individuals will submit their experiences of maternity care via an online form on our website, and they answer some key questions about their experience. And then there will also be some undertaking deep participation work with a smaller cohort of women, hopefully around 5 to 10 women. And these people are regarded as experts by experience, so we'll be taking oral evidence from them in the form of interviews, and they'll be more involved in the inquiry, in that they'll be invited to tell their stories at oral evidence hearings if they wish. And they would be working in collaboration with the expert panel to come up with recommendations and solutions for change based on the findings from their oral evidence. So we're really keen for the ethos to be one of empowerment. So it's about hopefully reclaiming these negative experiences and turning it into something constructive. We really want to honour and respect the stories that these women and birthing people are sharing with us. All too often, I think women are asked to share their stories and not a lot happens with them. We're really aware of falling into the trauma porn trap and want to avoid this. So all of this participation work is being done in a trauma-informed way. We're working with a clinical psychologist to ensure that participants are kept safe psychologically during the interview process and throughout the whole of the inquiry. So women and birthing people have access to psychological support if they need it. And so the call for evidence is also open to healthcare professionals as well, working with them in maternity services. We want to give healthcare professionals the opportunity to tell us how systemic racism may be impacting on their abilities to deliver safe, respectful care, if they think it is at all, and if they do, then how it may be impacting on them individually at their place of work. And we're also really keen to hear positive experiences as well. We think that's really important. If individuals have received good, culturally respectful care, then we've asked women to share that and give their examples of this. As we think it's really important to find out what good care looks like.
That's really great. Sorry, so, that's really great, but I'm going to have to sort of end it there. And I'm sure if you or Amy could put in the chat perhaps a link to the call for evidence where people can find out more about how they get involved, I think that'd be really useful.
Sure.
And so for the next 10 minutes, there's going to be a question and answer session. And we wanted to kickstart it there with a follow-on Mentimeter interactive activity. This one will generate post-it notes rather than a word cloud. So you are welcome to write in full sentences, not just single words. And the question that we wanted to put to you was, how will you commit to move? So it's going back to what Cara was talking about earlier and thinking about the need for action, the need to move through the sort of emotional discomfort that people might feel, and to actually do something constructive and pragmatic, like we've heard from many of the speakers this afternoon. So the question is, how will you commit to move? And I'll let you fill that in and come back to it just before I close, whilst I ask the speakers some questions. Is Cara still with us? Because I can't see her face in front of me. Cara, are you still there? Oh, that's a shame. Okay, well, oh no, I can see you again. Fantastic. So the first question I wanted to put to you, actually, if that's okay, and it's going back to what you were saying about roles. I really liked the way that you talked about, you know, some people can lead in this space, some people can help the stragglers, some people can sort of stem the tide and resist. And I was sort of thinking it would be really helpful, I think, to the people that are with us today, if you could sort of maybe apply that to what roles you think charities, and especially health charities, could and should take in this space. And I'm thinking about both charities that sort of support people with long-term conditions, like many of National Voices members, but also sort of umbrella bodies, infrastructure organisations, like National Voices itself. Just if you had some thoughts about the kind of roles you think we could do to move.
Yeah, so I saw someone put, you know, is our service provision or our campaigning more important? And I think they're both just as important. As I said, it's a whole hive of activity, and whatever I like to think about the small axe chop down the big tree. Like, we've each got our axe, and what is it that yours is doing? And if that's providing a service that is genuinely there for people of colour, that's really important. And if you don't have campaigning expertise, you know, if you're not, you know, in the corridors of power, like with the ear of politicians, that's fine. You've still got a role, which is really important, especially in health, where, you know, we're trying to provide services. So it really just depends on your expertise as an organisation. For umbrella organisations, you know, that's the role that Youth Access plays as well. I think for us, definitely, like the policy influence and efforts that we do are important, but then it's about the practice delivery the practice support work that we do as well is just as important. It's like a different theory of change. There's a sort of political theory of change. If we can just convince politicians to put more money into this part, maybe we can get better services. Then there's the other theory of change. Got some money and we can equip them to do better, then we have a direct impact on those young people through those services. So I think that's something that National Voices can provide, is that sort of rallying of energy, provision of resources, creating of spaces, and that element of collective care as well. How do we look after each other when we're going through that, whether we're people of colour, whether we're white people really struggling with that journey as well.
That's really helpful. Thank you very much.
So I think my connection's really bad, sorry.
Don't worry, I heard virtually all of that, so I hope everyone else did too. Amy, I wanted to turn to you and ask you a question about what you think is the most important thing we need to change about ourselves, and sort of to apply that in a way to this issue of the workforce. And I remember Cara saying there's sort of, on the one hand, you could diversify your workforce, diversify your board, but is that as important actually as possibly training the existing workforce and really changing the culture within? And if you're diversifying, how do you do it? How do you get buy-in from other partners?
So from our perspective at Birthrights, I think we're trying to do both. So we're trying to recognise, I've just answered one of the questions actually in the Q&A about the sector and where we're falling short. And I think it is a real problem to be a sector that says we're tackling rights issues, and racial injustice being one of them, but be predominantly a white sector, particularly at leadership levels and paid leadership levels as well. And, you know, I say that very aware as that I am one of the benefits of the beneficiaries, sorry, of the stacked system at the moment. So I think we do have to look at inclusion within the staff team, but we also do absolutely need to train the existing workforce. So we have invested in we did some LGBTQ competency training at the beginning of the year, which was really powerful for the team. We've got anti-racism training coming up soon. I think you have to, you know, we're a tiny charity, but we have been able to secure through our grants some of our grant funding towards training like that. You know, there is money out there towards you doing that internal work. But I think it also has to be kind of ongoing culture and learning. And we've offered that to the board and the staff team. I think it's really important that, particularly in tiny charities, that they aren't separated in an artificial way. Like, the board have got to be on board with this as much as the team are. But I also think it's important to be aware that everyone within that team and board might not be starting from the same place. And it comes back to that safe and brave spaces that Cara has coined, or, you know, through that work, talking about those. I think you have to try and create that safe space for your staff members, particularly people with lived experience of some of these issues, but also be willing to be brave and and get pushback from potentially your board or from partners who might think you're focusing on the wrong things. But I think from our perspective, to be credible in terms of tackling these issues with the NHS and with other decision makers, we had to do the kind of inclusion within our own organisation as part of it, because otherwise who are we to, you know, glass houses and so on.
Practicing what you preach. Absolutely. Thank you for that, Amy. That was really helpful. And I just want to sort of pick up actually the issue about people supporting people with lived experience, making space for people with lived experience, and ask Melissa a question, sort of mindful of the potential that the experience of being involved in this kind of work could bring up extremely difficult, if not traumatic memories, could be re-traumatizing, requires safeguarding and therapeutic considerations, and just sort of how you make space for that lived experience to do this kind of, you know, triggering work.
Yeah, absolutely. It's a massive sort of key part of the work that we're doing, is trying to be mindful of that and the potential for you know, re-traumatization. And when we're asking women and birthing people to share these experiences, how we make people feel safe enough to do that, number one, and ensure that they feel that once they have, that their stories have really been respected and honoured. So I kind of touched on it briefly, talking earlier. You know, it was a real important part for me when making my proposal to Amy about how we're going to undertake this participation work, that it was paramount that we have to make sure that anybody who's involved is and to be sharing their stories is going to be psychologically, you know, looked after and safe. So as I said, we're working with the clinical psychologist to help to formulate the interview questions to make sure that they're not, they obviously, while we want to get the right information out of people, data to help with our inquiry, we also want to make sure it's done in a very sensitive way. Just to working in collaboration with the clinical psychologist to formulate those questions, and as I said, also having mental health support on hand for all the participants that are involved. You know, and as I touched on as well, it's often women will come in and the issue might not necessarily just be about the maternity care. There might be other things that we've talked about intersectionality. There might be other things going on here. So they might come in and there's an issue that arises about housing, for example, or something else. So it's also about knowing where to signpost to and making sure that we've got stuff in place for those women, or if those issues do come up, that we know where to signpost people if necessary.
That's really helpful. Thank you so much. I'm just going to have to stop you there because we've only got a few minutes left. I'm so sorry. I wanted to share the Mentimeter response, the post-it notes about how people will commit to move, because I think it'd be, you know, a really good way to end, to sort of think about the active ways forward here. So people have said, bringing this learning back into my organisation, encourage people to respond to this inquiry. That's wonderful. Contributing bravely rather than being a passive bystander. Start with small steps. Hope this mobilises an army. Work in collaboration with others to make changes happen. Oh, this is fantastic stuff. And it's just wonderful to see at the end of this day, where we've dealt with so many, you know, hard, heavy-hitting subjects, people are committing to moving and to taking action. Yeah. I had wanted to ask all the speakers a final question, but we have run out of time. The question I was going to ask, and feel free to put it in the chat if you would like to, is, you know, how to move despite all these massive emotional barriers. Like, you know, what would your advice be in terms of like self-care for people? Because I've sort of read, you know, self-care is an act of resistance. And I think particularly in this space, you know, it's mindful of the potential to re-traumatize and how difficult it is to confront things about ourselves as individuals and the biases that we have, and, you know, perhaps some dysfunctionality in our organisation. So speakers, please feel free to put in the chat sort of any advice you have for people about how to deal with that emotion, to overcome it and to stop being inert and move forward. And I just wanted to thank you all again for joining us this afternoon, for sharing your reflections and your questions. Thanks especially to Birthrights and Youth Access for organising this session and for sharing your experiences, your insights, the really inspiring work that you're doing. Thanks to the teams at National Voices and PPL for putting this webinar together, and thanks to our sponsor, the Health Foundation. Please join us next Tuesday, I think it's the 16th of March, when we'll be discussing digital exclusion. So really thinking about health inequity in the context of healthcare services. And the following week, the 23rd of March, we'll close our conference with an extended plenary discussion about what next and how we can take action together. So there'll be more time for thinking about how to move then. And I hope to see you then. And thank you all so much again for joining us today. Have a lovely evening.